Hey guys, I just wanted to talk to you a minute about ozone therapy, or using oxygen to really modulate your own biological response to healing. It is such a powerful way to help your body do what it's made to do already. Ozone, or prolozone, there's two different ways to use it, but ozone increases your body's ability to decrease inflammation, increase oxygen utilization, and reduce the pain at the area. It actually activates growth factors in your body. So it takes a powerful medical grade oxygen. We use it in different ways to put it into your body to modulate how your body is responding to an illness, an acute illness, a chronic illness, pain, whatever it may be. Chronic pain and degeneration in and of itself happen because tissues don't get enough oxygen for whatever reason it may be, because of lack of circulation, because there's some kind of compression, because there's diabetes that's affecting the inner lining, because there's been an acute injury, whatever reason, there's a lack of oxygen to there that causes this inflammation and pain to that site. When we deliver oxygen directly to that site, it's like flipping your body's repair switch on, and your body's then able to utilize that oxygen and can help restore circulation, help decrease the inflammation, restore nutrient delivery right to that area, and mitochondria, which is our powerhouses of our cells, are able to be utilized better and are actually able to function the way they're supposed to function. So there's a few different ways we can do this. One is called major autohemotherapy, and that is where we take some of your blood and we put the ozone directly into your blood and return it back to you. It's very cool. When you do that, you actually see your blood change color from like a darker red to a brighter red, and we actually put it back into you. It is an IV treatment, but it can be very, very useful to modulate your immune system, and it's been helpful in chronic conditions like Lyme disease, chronic pain. It's been used as an adjunct for cancer therapies. It's been used for autoimmune issues, long COVID, chronic fatigue, all of these things. This is a therapy that typically is a couple times a week over several weeks, and you kind of wean it down to maintain. There's other methods to deliver oxygen to your body. There's another method called prolozone, and that's where you take not just the ozone, but you also take some growth factor specific nutrients and some pain medicine directly to the site of the pain. So whether it be a joint or your back, we can use it and put it directly in there as well. That can be very helpful to stimulate those growth factors, decrease inflammation, and really help with immediate pain relief. Again, typically takes a couple of injections and then you feel better. You're able to walk out of the appointment right away and go on with your day. We just don't want you doing a lot of strenuous exercise for the first 3 to 4 weeks. Urine cephalation, that's also a really cool way to do it. If you have an acute or chronic sinus issues or some kind of respiratory issues, even for kids, we can put ozone directly into the ears. We've seen such great results from that. People will come in with an acute sinusitis and they will walk out and they will just dump all the junk out of their head because it decreases that inflammation immediately, and they will feel better within the first few hours. It's really good for people with chronic ear infections like children. I want you to think about this. These kids who get chronic ear infections and they're on antibiotics all the time, those antibiotics tear up the gut, really cause other issues. So if you want a non-invasive thing, we just put it in their ear. It takes about 2 minutes and they're good to go out the door. Very, very great treatment. It's tiny but very effective. Scars, you can actually inject ozone and some of these growth factors right into the scar. And if you're not aware, scars can really block nerve communication, can block blood flow, can be a cause for some chronic pain, but they also sometimes hold emotional trauma. And so going in there and breaking up scars, one that I specifically talk about is woman's hysterectomy scar or C-section scar. That one's pretty central to your body, so it holds a lot of tension in there. But any scar, we can go in and inject that. That typically is just one treatment, maybe two of that one. But we really want to really hyperoxygenate these cells and really promote your body's ability to do what it's made to do. This is what we do. We want to help support your body in doing what it's supposed to do by combining these therapies with other therapies to really make everything work better for you to heal better, for you to get back on your feet better, for you to get down off your pain medicine, to really help with your chronic pain issues and function. A lot of these will help with mental clarity. They can even help, like I said, with emotional wellness as well, adrenal fatigue, because we're holding some of this emotions in there. We need an adrenal reset. Using the prolozone on the scars can be very helpful. Most patients feel a remarkable lift in energy and fatigue and mood after ozone therapy, especially the major autoheme therapy. That's because it really improves that mitochondrial function. It gives you immediate energy at a cellular level. Most ATP produced by the mitochondria, so the more you can stimulate that mitochondria, the more ATP you're going to have, the more energy you're going to have, and the more you're able to repair your body, the more you're able to recover faster. So So a great way to naturally help your body do what it's supposed to do. Ozone fits perfectly in a root cause functionality because it targets the terrain. It's not just targeting the symptom, it's actually going to the root cause and helping the mitochondria work the way they're supposed to work, giving your body, the cells, the oxygen and the nutrients they need so that they can detox, so that they can decrease inflammation, so that they can modulate your immune system all together. Whether it's through the MAH or ear insufflation or the prolozone injections, there's multiple methods to do this, but they can all be very, very beneficial and natural way to help stimulate your body. So let us know if you're interested in more information.